Guys, it's Ashley with Amare. We need to talk about something. So this has been cycling social media, and I've had several, like more than 10 clients this week come in and talk to me about this. It's extremely sad, but a 33-year-old woman went to DR to get plastic surgery done. She, I believe, do not quote me on this, but I believe she went for BBL and lipo. She went there the first day that she was supposed to be there for her surgery. She had high blood pressure. They waited 2 days. The second day, the second time they tried to do it, she still had high blood pressure. So they waited, and then they did her surgery after that. She never changed her flight back home, and she winded up leaving early. She never extended her stay. She left early from DR. She winded up coming home, and a day or two later caught a blood clot and passed away. This is something that everyone has addressed and is blaming surgery in DR for. Yes, should the surgeons maybe have not let her leave? Yeah, but also free will choice, we're human. Now here's the thing. Getting plastic surgery in DR is not a bad thing. Like I've said many times before, I have tons of surgeons in DR that are fantastic, that I love. Here's the problem though. It's all aftercare. And now everybody always asks me, what made you get into this? So I was working with cancer patients when I first started doing massage 7 years ago, and I was working with them with lymphedema. So I was already doing lymphatic drainage, but it was just for lymphedema. When I started actually putting the word out there that I was doing manual lymph drainage, I had a lot of calls for plastic surgery, and I saw a lot of gruesome things very quick. Really, really quick. Within the first 2 months, I saw really bad botch jobs. I saw really bad fibrosis and all of this stuff. Now I have a video talking about botched, and what does it mean to be botched, and how do you know if you're actually botched or if you're just having a really bad recovery. But this is one of those things, which is why I want to talk to you about it. So, hold on. So when we're talking about getting surgery in another country, we know, or in another state, we know there is going to be a certain time that you need to recover for. We know that there is going to be a certain extra steps that you need to take to get to that point where you're, recovering. But you have to take this shit seriously, guys. Excuse my French, but it's not a fucking joke. You have to take this shit seriously. And that poor woman is proof of that. If you're going away somewhere, you need to make sure you are cleared to leave by a physician. You need to make sure that you're okay to travel. And if you're doing it here, you should still be checking in with your doctor. You should still be making sure that you're healthy. Guys, surgery is not a little thing. This is a serious thing. This is a health risk thing that you're doing. You have to take this seriously. And the aftercare is just as much. So the compression socks that you guys wear, the white ones, or the ones your doctors tell you to use, is to prevent blood clots, right? In your legs, because you're not getting up and moving a lot. So the thought process behind it is if you're not mobile enough, because you can't be, because you're in pain, that the socks are going to keep the pressure off of your vascular system so that you won't throw a blood clot. Because that blood is just sitting in your veins, and the pressure from the swelling around it and blood clot. So that's the thought process behind that. One, you should be up and moving, as soon as you possibly can. Get off the oxys, get off the perks. I have videos on that. Get off of that stuff, get on Tylenol, and get up and moving ASAP, as much as you can, without causing pain and without being uncomfortable and without it feeling horrible. So that, the other thing is the socks. So you should be wearing those from 10 to 14 days or 7 to 10 days. I say in my practice, go off of what your doctor says. Go off of what your doctor says for you to do. If he says 14 days, stick with them for 14 days, unless they are really, really badly cutting into your legs, causing more swelling, because then in that case, it's kind of dangerous. And then you should consult your doctor about it and make sure that it's okay for you to kind of discontinue them. Some doctors will tell you to take them off earlier if you call, but it totally depends. So the compression socks is one thing. Getting up and moving is another thing. But guys, the biggest thing that went wrong here was the aftercare. Because if somebody was looking after her in DR, she wouldn't have left. If she'd stayed and done the aftercare in DR and extended her trip, that may not have happened. If she came back and went to a primary care doctor or something, it could have been, totally different. But again, guys, this is not a game. Your aftercare is so beyond serious. I don't know how much I can stress this. So, like I was saying, the reason I got into this is because I saw so many things that you guys would come into my office with, so like confused and distressed and pretty gruesome, honestly, and had no guidance and had nowhere to turn and had nothing. I even looked for you guys. There was nothing. There was no doctors specializing in it. They would go back to their surgeon and their surgeon would say, oh, it's fine. You look fine. Don't worry about it. Like, there was no help out there at all. So I created Amare, and here we are. But this is why I'm still so passionate about this stuff, guys, because it makes a difference, not just in life or death, but in your results. You don't want to look like you looked before the surgery. You want to look like you had surgery. You want to look better than before. That's the point. And your recovery is the biggest part of that. Now, people do not want to spend more money than they have already on the surgery. And I totally understand that. But like I said in my last video, last week or the week before, you do not buy a Mercedes and not take care of it. You don't buy an expensive thing and not do the maintenance and take care of it to make sure it'll last. So why are you doing the same thing with your body? And again, it's not as expensive as everyone thinks. So a recovery at Amare, at most, with 8 sessions, if we're doing the whole package, 8 sessions, your post-op session consult with me, your faja, your foams, the soap, the post-op soap, the wound care, if you need a BBL pillow, the arnica cream, the detergent for washing your garment and your foams, like the actual special made detergent, and then, I don't know, any other little things that you could possibly need, at most is going to be $1,500. At most. Any extra sessions that you do is obviously going to be more. But at most, to get you on the right track and get you safe and get you recovered, it's not that much more. I understand it seems like a lot, but guys, throw it on a credit card. Do something. Like, you have to get this done. Now, we can do our sessions in chunks. We have a 4-pack and an 8-pack, so you don't have to buy the whole 8-pack all at once if you don't have the funds for it. We work with you guys like that all the time, and it works for a lot of our clients. But guys, again, this is not a game. This stuff is serious, and that poor woman was only 33 years old. Like, it's not like she was older for any reason. And people die all the time from plastic surgery, and you never really hear about it much unless you're looking for it, unless you're in the plastic surgery world, unless you're going through all of this and you hear about it. I don't know what it is about this one case that everybody this week, at least 10 people this week, have told me about it and asked me about it and like, oh, DR surgery is so bad. That shit is so dangerous. No. It's not. It's not. The recovery is dangerous. The aftercare is dangerous. The things you put your body through after surgery is dangerous. Again, one more time, if I take a knife and I slice your hand open and I stitch it up, how are you going to take care of that for the next 4 weeks? Well, maybe you're going to put like a board or something and some compression, right? So that you don't smush the crap out of that every time you try to use your hand, number one. Number two, you're going to treat it with some sort of wound care. You're going to wash it with antibacterial soap. You're going to make sure that you're, icing it or doing whatever you need to do for it. You're taking care of that thing. Your surgery is no different. No different at all. So I really need you guys to start like seriously being serious about this stuff. Like, this is not a light thing. This is not a game. This is not like, oh, I just, went out and did surgery and that's it. Like, no, it can really mess you up. I mean, fibrosis aside, hardness aside, swelling aside, there are actual deeper health issues that you can develop from your surgery. Seromas, which are pockets of fluid, infection, cellulitis, which basically just means you're like irritated, infected swelling. They give you antibiotics, it goes down. Cellulitis, any of the other crazy health things that you guys get from plastic surgery. It's serious. It will affect you permanently. Something even as minimal as scars, right? So if you have garment burn, now garment burn looks like a really big blister where all your skin on that blister turns like kind of black and purple and peels off your body. And then you have a giant burn. Now that can be like little garment burn, like lines, or like little patches, or that can be across your entire back and down your ribs. It can get pretty serious. Basically, your garment's not fit properly, it's not cut for your surgery, and it's not cut for your body, and it's not the right size, and you're not wearing it right. All of those in combination or separate will cause garment burn. So it's the garment literally burning away at your skin. Also, if you're washing your garment with something that is not, recommended by us as far as detergent, you're gonna get a chemical burn or a rash from the garment. So again, something like garment burn. That missing chunk of skin, depending how big that garment burn is going to be a permanent scar if we don't put wound care on it and treat it properly. That is a permanent side effect from your surgery. That is something that, yes, you think about the cannula scars, you think about the lipo scars, you think about the tummy tuck scars, but there are other things that can give you permanent problems or change you permanently from surgery, such as fibrosis, which will mess up your results, or garment burn, something like that, or taking it something as serious as anemia, or blood clots, or seromas, or if you have fibrosis or a seroma and you have to get it surgically, taken care of. That's another surgery. That's another permanent thing. Now, why do people say it's dangerous in DR? Because when you're here in the States, the doctor can look over you, or in your state, the doctor can look over you a lot easier, and if something goes wrong, you get rushed to the hospital. A lot of doctors out here will have you stay overnight in the hospital just to make sure you're okay. So it depends. But DR is not a bad place to get surgery. It's just they don't do any aftercare. They don't do any checking on you after that. Their so-called massages are, again, something that can permanently damage your results. It's just that they're not well equipped afterwards. Now, I'm not saying that doctors out here are any better equipped, but at least we have the medical care to take care of you. If something crazy goes wrong, you can take yourself to the hospital. But again, doctors do their job, they do the surgery, and that's it. They're not doing the aftercare. But out in DR, you're staying in a recovery house where they don't speak English, or you can't go to the hospital readily available, or again, your doctor is just there to do the surgery. They're not providing you all the aftercare like we do. They're not giving you the top-notch supplies. They're not giving you the top-notch massages. They're not doing all of that because it's not their job. So again, surgery in DR is not a bad thing. The surgery itself, if you're looking for that DR Barbie doll look, dude, do it. Absolutely do it. But you have to make sure you're doing your aftercare when you come home. You have to make sure you have a support system and a plan, and be smart about it, guys. This shit is serious, and it's not something to just take lightly. So again, I'm a total advocate for getting surgery in DR. That is not the issue. The issue is being smart. The issue is if you don't feel well, don't leave. The issue is if something's not right, go back to your surgeon and be like, look, I'm not leaving until I feel okay. Even when you come home, if you even feel a little bit off, that's kind of not normal for what you were feeling out there, go to the hospital, check. You could be anemic. Something could be wrong. Blood clot. But again, you guys, you have to start taking your aftercare seriously. I understand you don't want the added expense. I understand it's an unforeseen expense for you guys sometimes because you don't do your research, but you have to start taking this seriously. Plastic surgery in DR, like I said, is not a bad thing. Now, I'm going to add a little caveat to this. Can it be dangerous out there? Yeah. So I came across a video from a DR doctor who was doing a transgender surgery, making male-female, and he was breaking, so the person was on their side, and you can hear the crunch, and he took his hands and pressed on the person's floating rib and broke it, and then shoved it underneath their other ribs. Now, I am not a doctor. I am not a surgeon. I am not a medical health professional. But I don't want anybody breaking my ribs for surgery. I don't want that. I also came across a story of a girl who went to DR, and she wanted to get lipo and a BBL, and she showed them their wish pic, and they talked about everything, and it was fine, and she went in for surgery, talked about it the day before, mind you. Talked about it the day before, she went in for surgery the next day. She woke up, and she had a breast lift. And she was like, what the fuck? And her doctor was like, well, we wanted more lipo for your BBL because that's what you wanted. But then you had loose skin, so we lifted it for you. She was like, I didn't agree to that. But again, some doctors in surgery will do what they think is best for you and take their creative liberties. I've seen that here in Jersey sometimes with ab etching, where you'll wake up and doctors will be like, oh yeah, I threw in a free ab etching for you, which is basically where they etch the lines under your skin of your abs so you can see them better. But guys, if you gain weight, you're now going to have lines under your skin. So she didn't ask for that. They threw it in for free. And as far as I'm concerned, that's a violation of my body. But doctors do the doctor thing. They do what is best for you in surgery to make sure that you are healthy and take care of you in the best way. That being said, you have to be careful. Because again, in DR, I'm watching this live where they're breaking this person's ribs, and I'm reading all the comments, and people are like, oh my God, I want to get this done so bad. Oh my God, I can't wait for my waist to look that snatched. And I'm like, girl, you're talking about breaking ribs and shoving them up under the other ribs. You have organs under there. Like, I get they're a doctor. I get they know what they're doing. I understand that. But there has to be some common sense and safety lines with this stuff, guys. Like, the fact that there are actually all these girls out there that want to do this so bad. Go back to my video the other day about plastic surgery is not evil. Like, you have to have the right motives for these things. Because if you don't have the right motives, you're not going to make the right choices. You're not going to be health conscious enough when you're in these situations. And you're not going to be taking safe precautions and making safe choices as far as getting surgery out in DR and coming home and making sure that everything's going smoothly. So, again, DR surgery is not a bad thing. They can do things out there that we can't do here. They can get your body to look in ways that we can't get it to look out here. They can do surgeries to the extent and length and technique that we can't do here. If that is what you want, go. I am not saying don't go. I'm not saying it's evil. I'm not saying it's a bad thing. But what I am saying is you need to be careful. You need to take every precaution. I cannot tell you how many people come into my office and I ask you, what painkillers are you on? And they're like, oh, I don't know because it's not in English. And I'm like, you don't know what you're taking? And they're like, no, they just gave it to me. It's not in English. And I'm like, you're still in pain? They're like, yeah, massively. I'm like, how do you even know it's a painkiller if you can't read it? And they're like, I don't know. They gave it to me and told me it was. And then I ask you what antibiotics you're on. And you're like, oh, I don't know. That's not in English either. Like, how do you know if you're being taken care of, guys? Like, you have to be more active about this stuff. You have to care. You have to make sure you're doing your research. And if you don't know what the medication is called, Google it and then translate it and figure it out. Because that's something that you really need to know. Because again, there are a lot deeper, bigger health risks than just your surgery and just your pain management. You have to be taking care of these things. So again, guys, going to Mexico, going to Arizona, going to DR, going to Florida, going to, what was the other one I heard the other day? Australia? Going anywhere outside of your state for surgery, anywhere that doesn't have, the best health care, you have to be so careful. So careful. Because, guys, this is like a serious thing. And this is a permanent thing. And it's a life-changing thing. We want it to be life-changing, serious, and permanent for the better. And not the worse. So that is all I have to say about that today. This video will go live on Friday. I really thank you guys for watching. Again, please, guys, make educated choices and be safe. I have seen too much of this stuff for 1 week. Please be safe. And if you have questions, if you are going to DR, if you want guidance, if you want help, if you want to make sure you're taking every precaution and being safe for your surgery, you can always set up a virtual with me. And we will go over everything specifically for you, specifically for your travel, your stay, your surgery, your health precautions, all of that, especially if you have pre-existing health conditions. So guys, it was great talking to you. Have a great rest of your day. Thank you for watching. Bye.